So, Professor Stucki, that was a very insightful lecture, and we now know that WHO is kind of highlighting that we need to give emphasis to functioning as a third very important indicator of health. The question I have is, how do we implement it, and what sort of staff do we need to implement this at a global level, and what's the role of a PRM physician in this, please?
No, I think that's exactly the right question in the sense of what is the next step? How can we bring it on the ground? And I have several aspects here. The first is we need international standards and tools. So it's not that one clinic can do it.
Right.
So we need to agree on what we are doing. And that's why the ISPRM, the International Society of Physical and Rehabilitation Medicine, is developing ClinFit, which is a very versatile tool that can be shaped for all the different purposes. So that's number one. But who's going to take it up? I think we will have then the European level with the standards from the UMSPRM section and board. For example, the individual rehab project, which is nothing else than a process, how you can structure the process using functioning information. And ultimately it is the training of all team members in ClinFit, let's say, so that we can really bring it into the daily routine.
Okay. And what's the role of PRM physician in the whole process, do you think?
So the first role is to spearhead it. Yeah. I think we must have a group of clinicians that really are behind this thinking and spearhead it with the team members, which actually is very, very easy because I know that many, like physiotherapy, occupational therapy, are very willing. So he can be the leader of the team.
One final question. Do you think we will reach a state where every health service will be paid based on their outcome on functioning? Will there be payment based on functioning?
That is already the case in some countries. I think we must make sure that we have a valid measure of functioning, and not to forget that sometimes it's not only to improve functioning, but to maintain, to prevent a decline. So we need functioning trajectories and benchmarking control trial. And that obviously is going to be the future. I agree.
Thank you so much, Professor Stucki.